Hi, I'm Mariana Brussoni. I'm a professor at the University of British Columbia in the Department of Pediatrics and in the School of Population and Public Health. I'm also an investigator in the BC Children's Hospital Research Institute. My research team and I, along with Indigenous knowledge keepers and collaborators from across British Columbia, recently published an article called The 5 R's of Indigenous Research as a framework to co-design and evaluate an outdoor play program in early learning and childcare centers. And this is a research protocol of a study that we did together over the course of several years. And it's published in JMIR Research Protocols. The purpose of this paper was to describe the process that we went through with a steering committee that was made up of Indigenous elders, knowledge keepers, and provincial organizations that are in the childcare space across British Columbia, working together with childcare centers across British Columbia to develop a research study, which was a randomized control trial to implement and evaluate an intervention called the Promoting Early Childhood Outside intervention, or we call it PRO-ECO. And the purpose of the intervention and the program is to work with child care centers to help them change their practice so that it's easier for them to get the kids outside and playing and provide kids with more affordances and freedom to play when they are outdoors. So in this paper, we described the process that we went through to plan the study, because randomized controlled trials are a very Eurocentric, colonial form of research, of course, but we were working with Indigenous communities and we're really wanting to be mindful of bringing together Indigenous perspectives and lifting them so that they would define the work that we would do, how we would do it, what we would measure, and so on. And we used the 5 R's process: respect, relevance, responsibility, reciprocity, and relationship, to work with our steering committee and with the communities to design the study protocol for this mixed methods waitlist control cluster randomized trial. And so by describing what we did, not only do we want to provide an indicator of how we conducted the study, but the process that went behind it, so that we could ground our work in the 5 R's and shared values and disrupt traditional academic power relations and weave together Indigenous and Western worldviews in the context of academic research, possibly giving others a way forward if they're looking to do a similar thing. We chose to submit to JMIR publications because they had the research protocol arm of their journal publications, and this was a good fit for putting our research out there and being able to have the space to describe the details of what we went into, so that others could pick up the research and learn from it.